And taking a look at the numbers now, the average new case numbers are declining. 521 reported today. And digging deeper into that data, fewer people are being tested for COVID-19. Last week, we averaged 7,400 tests a day compared to 15,000 tests during our testing peak in July. Health experts are concerned as a result, we won't know how effective the virus is spreading in our communities. ABC 15's Claudia Rupsich looks at the decline and why it matters.
We would like to see a much higher number of tests right now.
Joshua LeBaire is the executive director of the Biodesign Institute at ASU. They've set up several saliva testing sites across the state.
We are seeing fewer people using those sites, so I think some of it is just a reduced in demand because the capacity is certainly there from our end if people want the tests.
Arizona has administered more than 1.2 million diagnostic tests. And while the number of tests per day fluctuates during the week, the average has steadily decreased in the past few weeks.
It certainly dropped off a lot over the Labor Day weekend, and it hasn't really come back big since the weekend. So, my worry is that people think, oh, we've beaten this thing, it's all gone, it's not here anymore, and that's not true. It's still here.
Sonora Quest, one of the state's largest labs, is now seeing about 5,000 tests a day, which they say is a significant decrease in demand. LeBaire says he's not sure why fewer people are getting tested, but he worries without those results, experts don't have a clear picture of how the virus is spreading.
Without doing the testing, we're blind as to where the virus is, and we know it's out there. We know it's prevalent in our community, but if we're not doing testing, we don't know where it is, we can't find it, and it could be spreading. And so, obviously masks are great and spacing is great, but testing is a key element in preventing the spread of the virus.
Epidemiologist Michael Warby at the University of Arizona says it's especially important for those without symptoms to get tested.
You need to find the people who have the virus and block that transmission chain from growing by isolating them, but also finding out who they've been in contact with because those people also might be infected.
Experts say if you've been around larger groups or you frequently interact with others at your job, you should get tested on a semi-regular basis. In Phoenix, Claudia Rupsich, ABC 15 Arizona.